Hello, today we're going to discuss BPH. Now, BPH is a very common condition. It occurs as we get older. Very rarely do we get any patient under the age of 40 with BPH. And what it is benign prostatic hyperplasia. That means the prostate has increased significantly in size to start to compress or press on the tube that leads from the bladder to the outside, and thus affecting the outflow of urine. So you can imagine the symptoms: difficulty passing urine, because it's almost like we have a narrowed door and the room is full of human beings trying to come out. So essentially we have trickling of urine or water coming away. Urine, I would refer to it as. So because we have trickling and poor flow, so the pressure from the flow is not as much as it should be, we can have a collection of urine in the bladder. And what that tends to do is that it keeps giving you a sense that you want to pass water. So in that sense, you tend to want to go all the time. And even when you go, you don't feel satisfied. You just feel as if there's something left behind. You have a poor flow, you have trickling, you wake up at night to want to pass water, you go multiple times during the day. It's not necessarily painful. On occasion, you can see blood. Now, you have what we call hesitation. So you get to the toilet, you stand there trying to urinate, but it's not coming, and then eventually comes, and it's a poor flow, and then you finish, and then there's dribbling. So it's so difficult just passing water, things we used to take granted just a few years before. It's a gradual onset symptom, so it creeps up on us, and thus we may not even notice. You may not even be able to give me a day when it started. I'll be surprised if you could, but it gradually gets worse. Now, the reason I'm discussing it is because I don't want us to take it for granted and just say, oh, it's one of those age-related conditions, because it can get worse. I'm going to discuss the possible complications in the next short, which is going to be the most important bits, just so that you can identify and know when to seek help. Thank you very much. Nice talking to you again. I'll be back to discuss some more. Thank you. Bye-bye.